on blue glasses. I have on red glasses.
Well, male, female, look at this. I mean,
Well, no, you're missing the whole election thing.
Oh,
The brain and the man, it don't go so
oh,
good.
Jesus.
The brain and the business. If all the blood is in the business, the brain doesn't work. Okay, you saw a guy, and you said he leaned to the left, like all the way to the left.
Yeah,
Extreme left leaning.
Yes, and I got to say it's uncomfortable. Yeah.
Anything to the extreme seems a bit too much.
Sure.
Too much.
Yeah.
I mean, but if he leans to the left, I mean, there are certainly are there people who lean that far to the right?
Yeah, and
I mean there are light right-leaning people, very extreme.
Equally uncomfortable
To the extremes.
Yeah, I mean,
maybe not a good thing.
And here's the kicker: like I've even had a guy who leans up.
Leans up?
Yeah, I mean it can bend any way.
I'm sorry, what are you talking about?
I'm talking about Peyronies or a curved penis. What the hell are you talking about?
I'm talking about the presidential election. It's Tuesday, the election. People who lean to the left, people who lean to the right. Good Lord. Do you ever think about anything else?
Not really.
Oh, my God. Okay.
Well.
You're weird.
Well, stream team, thank you for joining us.
The election.
Thank you for joining us on election night here. By the time this drops, we may or may not have a new president, unclear based on previous years. And
may or may not have a new husband. I don't know. I don't know what happens.
What I can say with certainty is here on Balls Deep, we're dead center.
Okay.
Yeah, we are.
Okay.
We are. I mean, we're just straight down the middle. We're trying to not be in the fringe of healthcare, but also to, be a little bit more open and fun with how we do things.
I'll take it. I like that.
Let's, what a great topic as we talk about bending and leaning and, let's do our deep dive into what we call Peyronie's disease. Sound good?
Okay.
All right.
Balls deep.
So, apparently we are talking about Peyronie's disease, and this will be a fun episode because I have no idea what that is.
Well,
there's a television commercial that says something about Peyronie's disease, and then it gives a weird picture of like a banana or something.
Yeah, it's the bent carrot ads.
The carrot. I'm sorry, it's not the banana, it's the carrot.
Banana was too on point. We had
too
to
on
come
point,
up,
didn't work. So tell us, what is Peyronie's disease?
So
not involving a carrot.
Yeah. So first off, which guy was like, hey, I'm going to name myself after a bent penis? Like, of all the different syndromes or things you get named after.
No idea.
So really it is simply that. It is penile curvature with erection that is typically acquired later in life. So a couple distinguishing things. Every guy has a bit of a angle to the dangle. Is
that the medical, the technical term?
I think
the angle to the dangle?
I think that's a reasonable way of putting it.
Good to know.
So again, for better, for worse, I see a lot of guys, they drop their drawers, I got to do an exam, and thank goodness most are flaccid, not erect when I ask them to do that. That would be awkward. And certainly some guys kind of may hang one way or another. We're not talking about that. We're also not talking about some people are born where, there's two erectile chambers, and just like someone can have an ear that sits a little bit lower or higher, or an arm that's a little bit longer, we can actually, as guys, have erectile chambers that one side is a little longer than the other, and there is a natural bend of the penis that's there from the time you first start noticing erections.
Okay, but that's not what you're talking about
either.
Okay.
So what we're talking about with Peyronie's disease is a guy develops scar tissue on the erectile chamber, and that area of scar tissue prevents that chamber as it fills with blood from expanding.
How would you get that scar tissue? What could that be from?
So most of the time we have no answer. Like a guy comes in with zero history.
Okay.
None. Now the classic history is the following. I was with my partner, came out, kind of missed the hole, heard a pop, felt a snap, went up against their pelvic area, and may or may not have any bruising or visible signs of an injury. But yeah, I remember that happened. And then 2 months later, I started noticing a curvature to the erection.
So there was an injury. There was an incident.
In select cases. But, I don't want most people thinking like, I took a ball shot or took a shot to the groin and I got Peyronie's from it. You can't hit a flaccid penis in any way that likely is going to cause this. So most of the time it's either no good reason or some sexual trauma. And the reason that this scar tissue causes a bending is, again, the penis is kind of like a spongy tissue. And obviously when you go from, again, soft to that diamond cutter we talked about, you remember the hand motion?
No, inappropriate.
So as we kind of go from 6 to 12, the blood fills. And if that part of the penis you're looking at me funny. Mm-hmm. If that part of the penis, because of scar tissue, can't expand, it's almost like kind of like a bike handle, right? So this side, let's say there's scar tissue on this side and none on this. This other side's going to expand more than this, and it's going to cause that bend and curvature. And so now the guy's going to lean to the left because of that scar tissue on the left. Okay. If there's scar tissue on the right, he'll lean that way. And if there's scar tissue on the top, it will lean up.
Okay, I get that. Is it painful? Is this a painful situation or just a visually off-putting situation?
It depends. Some guys will have pain. So now what we're taught is, again, outside of an injury, during the first 6 to 12 months of noticing the scar tissue, the scar tissue is still kind of like evolving. It's still figuring out like how much it's going to settle in. We call that the inflammatory phase. So whatever trauma happened, body's fighting that inflammation, that scar tissue's forming. During that, some guys can be uncomfortable, just even at rest. And certainly then when they have the erection, it can be. How much discomfort persists really depends on how much curvature there ends up being. Now, believe it or not, some guys can have a 90-degree bend in their penis. Like you could look this up on the internet, folks, if you want some good, funny, not funny if you forgot it, it's pretty sad, but believe it or not, a guy can have an erection and can have a bend where it literally curves straight up.
There's no way that can be anything but uncomfortable.
Absolutely.
Correct?
100%. Oh, 100% is uncomfortable. And obviously, after about a 60-degree bend, any sort of insertional intercourse becomes next to impossible.
Okay.
Now, luckily for most guys, they're going to have a more gradual sort of situation, or they might have more of a slight 15 to 30-degree bend where, depending upon which way it bends, it can cause various levels of discomfort.
Other than possible discomfort, other than possibly it hindering sexual activity, what are the other issues with Peyronie's disease?
There really aren't. So again, unless if it's not impacting your sexual activity, and I tell a guy if I see him, listen, if you're still able to have enjoyable sex, by all means, just keep going. Now, the other thing it affects sexually is it can also lead to some degree of erectile dysfunction because, again, if that chamber can't expand and fill with blood, the penis is not going to be quite as firm. And that could potentially cause even more damage because if you have now a penis that's bent and not quite as firm, any guy who's had any mild erectile dysfunction knows that, it's a little bit harder to insert. And as you're having that sexual intercourse, it's a higher likelihood that it could bend or pop or, God forbid, lead to a penile fracture. So, but really it's all sexual. It typically does not cause any urinary symptoms.
Okay.
Again, we're not talking about any sort of curvature at rest when it's not erect. This is simply penile curvature with an erection.
Well, what do you do about this? If you have terrible discomfort for this is hindering you in your bedroom activities. Are there medications? Is there physical therapy? I mean, what do you do for this? Is it reversible? Can it be reversed?
Yeah, great question. Some people, it will naturally improve over time. Okay. But typically by about 12 months, whatever curvature you have is likely the curvature you're going to stay with.
So that's going to stay with you.
Absolutely.
Okay, after a year.
And that's why we typically, and we'll talk about this in a little bit here, we typically don't recommend surgery in most cases until it's been at least a year of curvature. So most guys are very frustrated in that first year. They go, well, why can't you just fix this? Well, I might fix it and you didn't need the surgery, or I might fix it and it's going to get worse because the plaque's going to get larger and you're going to go back and have a second surgery. And then lastly, we'll talk about some of the complications with the surgery. But those first 12 months are that sort of inflammatory phase where it's still evolving.
Are there medications, or or are we going straight to surgery after 12 months?
Yeah. So medications. There are no, let's start off with what doesn't work, because as you imagine, afflictions of the penis have millions of guys Googling, what can I do about this? And whether you're going down some Reddit thread or, Dr. Google leading you down some pathway of a shaman who's telling you to rub coconut oil on it, might get you hard, but it's not going to fix the...
I'm not old enough to be having this conversation, incidentally, and my parents are going to be watching. But
So there's no ointments, there's no creams, there are no pills that are going to work. It's scar tissue
there's
deep
no
in the
medication.
penis. There's no oral medicine or topical. There is one proven FDA approved medication called Xiaflex. And again, Xiaflex.
Okay.
It's a collagenase, fancy doctor term for, we're going to use an enzyme. If you remember from your science days,
I do not.
ASE means an enzyme.
No.
Collagen is the root cause of most scar tissue.
Okay.
We're going to break down the scar tissue.
I thought collagen was what we put in our lips.
Well, you do, and that kind of plumps it up.
Yes,
Exactly.
Okay.
So
sorry, Xiaflex.
Xiaflex. So now here's the kicker. It's an injection.
I was going to say, because you just said there are no pills, and there's no topical cream. So the only other thing that I was thinking of is a shot.
Yep. You got a
shot to your business.
Absolutely. So,
okay.
Yep. So it's a
big needle.
No,
huge.
No. It's
small.
It's a Tylenol.
Okay,
it's a Tylenol, just a little prick.
Okay. Oh, wow. You tried to throw a little joke in there, didn't you?
I mean,
it wasn't great. Okay.
Whatever.
You tried.
It's late. I'm tired.
It's late. He's tired, but it's a little needle.
It's a little needle.
It's not that scary.
Yeah. So here's the deal with the Xiaflex injections. So first off, they work. They're very effective. Probably about 70+% are going to get guys to a point where they're like, I'm good. I can now have a functioning erection and it's straight enough, and I'm happy. It's typically given in 2 injection cycles, usually about 2 to 5 days apart. Okay. And you're going to have 4 of these 2 injection cycles. So you give a shot, 2 to 5 days later, you get another. Then you wait about 4 to 6 weeks, get your next cycle, for a total of 4 cycles times 2, 8 injections. Okay. That's a typical course. Now, obviously, this is done in the office, typically delivered by a board-certified urologist or, urology PA or nurse practitioner who's really well trained in this. The whole procedure takes a few seconds. Now, again, I as I joke with guys, I can't sugarcoat needle and penis in any way, but for most guys, it's usually not too bad. It's pretty quick. Sometimes some numbing medicine can be put in or rubbed on the outside. Most of the time I found just going right in with the needle is so quick.
Get it done. Get it done. Okay.
And what we're doing is we're sticking the needle in the plaque and then injecting that enzyme to break up the scar tissue.
And you're saying this works for about 70% of people?
Yeah, absolutely. Now, here are the downsides.
Okay.
Once we start an injection cycle, no funny business for about 30 days. Okay. And the reason is that enzyme is working to break down that scar tissue. Well, that scar tissue is on the erectile chamber. Erectile chamber is keeping blood inside the spongy tissue of the penis. If you get a tear or a crack, you now have something called a penile fracture. When does that happen? During sex. Okay. So we shut down sexual activity for about a month at a time. So guys really just get
Take a break.
Yeah, so you do the math and you're like, you get a couple 1 or 2 week windows in between cycles where you can kind of enjoy yourself. But most of the time these guys are doing it because sex isn't fun anyway. Okay. So that's one downside. Bleeding, infection, things like that are relatively rare. There's a rare but real complication. It's probably under 1% of getting that penile fracture. So again, even if you follow the rules, things can break because the enzyme just worked too well. Luckily, it's exceedingly rare. I haven't seen it, but if you do a lot of these, it's going to happen.
Okay.
Yep.
So for 70% of guys, this going through this injection cycle is going to solve your problem with Peyronie's. But what about the 30% of guys who are left?
Yeah.
Are these the surgery candidates, and is that the only track for them?
Great question. So couple points. First off, not every guy is going to be a candidate or choose to do the XIAFLEX.
Okay.
So good old insurance companies, of course, set their criteria, and a guy has to have at least a 30-degree curvature to qualify for XIAFLEX. The cash price is so absurd, we don't even offer it because it's
so high?
It's absolutely ridiculous.
It's astronomical.
It's ridiculous.
Okay.
I mean, it's predatory. So you got to have at least a 30-degree bend. Now, you could argue if your bend is less than 30 degrees, it probably is not impacting sex
Probably
that
not that
much.
big a deal. Okay.
But for some guys, it is a big deal, and they're kind of left without that as an option. So the other non-surgical option that works is something called a penile traction device. So stick with me here for a second.
Okay, I'm picturing like people in the hospital with like their leg and traction and old leg weights and weird craziness.
It's kind of built on a similar thing. Now
Okay,
it's a device. Now, in all fairness, this device was not made by someone with YouPorn. It was made with the Mayo
positive.
Clinic.
Thank you, Mayo Clinic.
Yeah, and so, as you'd imagine, it's sort of like a couple round cylinders. You put your flaccid penis in, and it's got all these contraptions where you take your flaccid or soft penis, bend it opposite the curve, because if you think about the scar tissue kind of going this way, you want to kind of bend it back that way.
It is a little like physical therapy.
A little bit like you're doing with your toe, right? Which, by the way, wearing your shoes,
the toe is improving. I know everyone was hanging and waiting to hear about that.
But we're talking about penises right now.
Yes.
So you bend the flaccid penis, and this contraption kind of sits against your pubic area. You kind of fasten your flaccid penis in it, and you do your therapy for 30 minutes a day, twice a day, and over 12 weeks has been shown to work as well. And so this legitimately works. Ballpark about $500 out of pocket. That one with the Mayo Clinic is made by a company called Restorex, Restorex, if my spelling was correct. Okay. And it works, but you got to use it. You know, you got to be compliant with it.
You have to commit to the 30 minutes a day trying to do the exercise. And if you don't do it, obviously it's not going to work.
Correct.
Okay. So there is that option.
Mm-hmm.
Lastly, I assume that the third and last resort is a surgical option.
Yeah, I would say right now, yes. Now, there may be some experimental benefit, and we just don't have a lot of great data on it today. We talked before in a previous episode for ED about shockwave therapy and PRP. Maybe those things could work. I've offered it to guys who don't qualify for the XIAFLEX and maybe don't want to do that penile traction device. I've had guys not at least get worse. I haven't seen any miracle cases from it. But again, when guys are desperate.
And we don't have a lot of data on that.
We don't have a lot of data, but it's safe. You know, we know we're not harming anything. Okay. And if we think of XIAFLEX as like we are chemically dissolving the plaque, think of the shockwave and the PRP as more of a mechanical breaking it up, right? We're shocking the plaque, trying to break it up, and then putting in some regenerative stem cells to see if maybe the body can heal that area. I only have a couple guys I've done that for. Again, they didn't get worse, but I can't say it didn't cure them. Yeah, so it just jury is out.
Jury is out.
Then final option, surgery. So I'm not a surgeon who does those surgeries. I think you should really, if you're going to have this done, go someone who's fellowship trained in this. This is one of those areas of urology where you don't want to go to the guy who does like one every couple of years. This is one of also the most litigious surgeries urologists do because, again, we're talking about a man's erection, right?
Men get very upset if those things don't work.
And here are the two main complications of Peyronie surgery: erectile dysfunction and shortening the penis.
Yeah, I'm pretty sure no one's interested in that.
Right. So it's a fine line, right? You think, well, I'll
No,
just cut.
it's not a fine line. I mean,
Yeah.
I think that's just the line.
Yeah.
I don't think anyone. I think that is the worst line
You see
I've
why
ever
guys are
heard
being
of.
happy. Yeah.
Got it.
So now it doesn't mean that all surgery leads to those two, but you have to be well
But
counseled.
it's a possibility, and you
possibility.
need to know what the possibilities are.
So I tell guys, listen, surgery is your last option. If you can make this work any other way, do it, because
Got it.
even in the best of hands, those surgeries can be can lead to either of those
Scary.
issues. And no guy wants a limp penis, and no guy wants a shorter penis. So.
No truer words have I heard today,
Yes.
or this week, or maybe this year, or this lifetime.
Yeah.
Okay, I think I sort of have a handle on what Peyronie's is, what causes it, what the options are. I prepared not at all for this podcast, so my takeaways are going to be your takeaways today.
Oh, and your favorite segment.
In my favorite segment, Just the Tip.
All right. So
And now I throw it over to you. You give us the takeaway tips today.
but you have such that sultry voice that goes over these just the tip segments.
Yes,
and
but again, I did not prepare.
you didn't. So
No.
that's how prepared we are on this medical podcast.
We are not.
Like, there's no research team. There's no,
And I don't know
there's
anything.
no hour. Like, we literally are just spinning this out. But I think it's all right. All right. So
You're
what
the
am-
doctor. What
Fair
are the
enough. I
takeaways?
better know what I'm talking about, right?
Please,
All right.
enlighten us.
So my three tips or takeaway points for Peyronie's. Number one, and I don't think we got to this earlier, Peyronie's is very common. This affects potentially up to 7 to 9% of men. And so if you have this, you're not alone. Number two, there really are no pills and ointments and conservative therapies outside of a penile traction device that are going to work. So use something reputable. This is not the time to go down that rabbit hole of finding things that are, off-label use. Third point, surgery is an option, but again, it should be a last resort. And if you're going to do this, make sure it's not only a board-certified urologist, but one who's fellowship trained in fixing this, because you get one shot to fix this and you want it done well.
Yeah,
How'd
you
I do?
Oh, I mean, I think you did great. But
Okay.
again, I wasn't listening to all of it. So,
No.
yeah, no, I
Well-
check out a lot. You're great.
Well, here, let me
did great.
end on a funny story.
Uh-oh.
So there's a variation of a curved penis called chordee.
Chordee?
Chordee, Chordee. And this is more of a congenital curvature, usually up or down, where there's just some underlying scar tissue in the skin and the way the penis developed. So we would fix this a lot in kids. But every now and then you get an adult who has this and it wasn't fixed as a kid. And it is often associated with this condition where the urethra doesn't zip all the way up to the tip of the penis. So the pee hole, again, medical
Pee-hole,
term,
technical term.
urethral
It's not.
meatus, for those who are keeping track, can not develop on the top of the penis. It could be on the bottom.
That seems problematic.
Yeah, and so you pee downwards, it can affect fertility. So there's a story from residency of an adult, and he was seeing the pediatric urologist, because pediatric urologists are the guys who fix this. It's called hypospadias most commonly. And the surgeon went and saw the patient in pre-op. His wife or partner was there, and she goes, "Don't fix the bend." And he goes, excuse me? She goes, "Don't you dare fix the bend." And he goes, "She likes the bend." So all that's being said, sometimes the angle to the dangle can be quite enjoyable for the partner.
And on that
hit
note,
hit a certain spot.
We're done.
So,
We're done. And I'm not old enough to be discussing these matters.
I think people want to know this. Dude, there's some guy out there who's got a little bit of a bend.
I was a debutante. Inappropriate.
Listen,
Inappropriate.
I don't care. Debutante, porn star, doesn't matter. There is some woman out there who knows what I'm talking about, who's like, yeah, he's got that curve and it's awesome. So
This was fun. Thank you for joining us.
yeah, so here, you close the show now. I did
I'll
your
close
segment. You're
the
going to
show.
close it this time.
Thank you for
so.
joining us. As Dr. Pizzona would say, take care of yourself. Give yourself some love and grace. We are all works in progress. And some of us don't need to keep talking about penises in front of something their father might watch.
I have children.
And you have children.
God bless them.
Bye.
See you guys.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Peyronie MD, please visit PeyronieMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.